is where we discuss the possibilities.
Hi guys, I'm Joe Klemczewski, founder of the Diet Doc, with an amazing guest today, Dr. David Braunreiter from the Houston, Texas area. Specifically, if you don't mind me saying, Sugar Land, Texas. Is that right, David?
Yes, that's where my practice is.
Okay. And David, you are an orthopedist, a medical doctor specializing in specifically sport injuries. So tell us a little bit about what you do on a daily basis.
Well, it's really technically sort of orthopedic and it's sort of not. I'm actually dually trained in primary care in sports medicine, so I can see a lot of different problems from soup to nuts, and I have an enhanced ability to work with musculoskeletal things. It gave me an opportunity as well to work with professional sports teams, which is one of the passions I've had besides helping people be healthy. Is I've always wanted to have a hobby within my profession. So being with a sports team really needed that extra training. It's an extra bit of time after your primary residency training in your main specialty to get certified, which I did 20-something years ago and
Gotcha.
been having it all since.
And if I recall correctly, you are from the northern Midwest, so you are a Packers fan first and foremost. Is that right?
Absolutely.
Yeah. Okay. But down in Texas, what teams? I know you have been involved, and even you have children following you into orthopedic and sport medicine. So tell me what you're doing right now in that industry.
I currently am still the chief medical officer, head team physician for the Major League Soccer team down here in Houston, the Dynamo. I've been a team physician for the Texans for their first 8 years. Did work with the professional hockey team that was here and the University of Houston. I think I tallied up this year how many professional sports seasons I've been on a sideline for, and it's kind of a big number. It turned out to be 35.
Wow.
35 sports seasons over the years. If I don't do it again, there'll be like a big hole in my schedule. So.
And your wife was bragging to me about you the other day that you are 8% body fat. So clearly. Yes. Clearly, you have an interest in being healthy, training. So what do you do for your personal health?
Well, I pay very close attention to my eating. I've actually adopted all the principles that we put together here, that you put together through the Diet Doc. And I track. I don't track super religiously, but I track enough I've tracked enough to know by eyeball and the sniff test how much I should eat at which meals, and I've targeted my different macro ratios at different times of the day to work with that. Plus, I keep up with a pretty rigorous workout routine 5 to 6 days a week. I usually take Sunday off for sure, and if Saturday doesn't work out, then I don't work out Saturday.
Mm-hmm. And you know, David, that's really why I wanted to have you on in our science or fiction segment. We've had Luke Probst on, and we want to continue delving into some of the more serious training questions we know listeners and viewers will have. But just as a broad stance, tell me, you know, a lot of people watching are going to be people who are lifting weights very aggressively. We have physique sport athletes. We have power lifters. We also have people who are interested in life transformation. They may not have that background, but they're going to be getting into a gym and they're going to be going after it, you know, full steam. What do you see in your practice where you would say, you know what? Here's where you really need to be careful. This may be pushing it too far, but as a physician who sees all of those, you know, injuries from the worst possible to, you know, weekend warrior stuff, what's your overall perspective?
Well, I think the majority of what I'm going to see in the office isn't going to be that elite person who's at the top end of the curve. They tend to have a pretty good awareness of body and tend not to take the risks that the people that try to dream to get there do. You know, and there's a lot of, truly, there are a lot of guys around my age, or 40 to 50 something, even 30 something, who want to try to recapture some lost youth and think that they're still capable of doing what they could when the testosterone was really raging, and end up overdoing it and overdoing something, not just by putting too much risk on a particular repetition of an exercise, but just over exercising a muscle group, like doing chest exercises 3-4 times a week or back-to-back days, and then starting to cause muscle breakdown and developing tendinitis, or even worse, risking a rupture of a major muscle or major tendon. Those are the things I'm going to see a lot. sometimes I'll see things with arthritis too as a part of getting older. Sometimes that happens and it becomes a bigger issue and it gets in the way. And frankly, weight plays a role in that. Currently what we understand for the knee, if you do the math, every pound of body weight you carry on your knee can magnify up to 8 times that same amount going up a set of stairs. Mm-hmm. And that's functional. I mean, that's not even talking about being in the gym. But they also come in at the age of 50 with the belly and wanting to be that 25-year-old guy that was ripped, thinking they still are. Mm-hmm. And I have to deal with the consequences that they didn't think about when they jumped in the first time.
Mm-hmm. So let's start with that elite lifter. Let's say that one of your children came to you and said, "Dad, I want to get into powerlifting. I'm 22 years old and I'm going to be working toward an 800-pound squat. And it may take me 10 years of training, but that's my goal, Dad." What does Dr. Braunreiter say to his child?
I'll first ask him why. Because there has to be a real why to it for me to say that's a really good idea.
Come on, Dad, I just want to do it.
Just want to do it. I shouldn't talk too loudly because at some point in my high school career, I had at least tied the school record for this max squat lift. So I can't be the don't do or do as I didn't do kind of thing. I have to condone that to some extent. It's just a matter of being progressive and being smart. 1 rep max lifts are kind of stupid. They really take a big chance on creating a risk for injury, because what do you do when you're stuck? I mean, you make sure you have a spotter, but even then you're going to try to rip through it, even if you can't get it. A 2 or 3 rep max is probably a goal to work with from my perspective to limit the risk of injury, but not focus only on that. Focus on the reps building up and be patient. Don't overdo it. Mm-hmm. Even at 22, you still can blow out an Achilles. You can still blow out a patellar tendon, rupture a disc in the back. I know these sound kind of grotesque, but they can still happen. They don't have to be an older person's injury. And at the age of 22, with an 800-pound squat lift, I have some serious concern about core strength and being able to minimize or eliminate the risk for stress fractures in the lumbar spine, because those are real. Mm-hmm. Number 2 thing I see in the lower back problem for someone that age is after a muscular strain, which is very common, is a stress fracture.
Mm-hmm. And do you see in people who are that aggressive in the gym, common injuries where you would say it's just not worth it? Or if you're counseling an athlete and that that's just their goal, they're an Olympic athlete, they're going to be putting their body through that risk. What injuries do you see the most, or what would you really tell them that they need to guard against?
Well, it depends on the body part that you're working with first. The back, commonly you worry about disc, and I worry about stress fractures, especially when you're doing Olympic style lifting or putting a big load on your spine with a bar like a squat lift. For the lower extremity, there isn't. It's really more just about common sense. It's always a risk reward for anything that you do in life, period. Mm-hmm. But understanding the why helps me counsel somebody on how can you do this safely? And if you have a setback, how can we keep you from falling too far off your path without risking a further injury? I guess that's kind of how I take the approach. It's a bit too generic a comment to answer, I know, but I think that's the best way I could answer your question.
So let me give you one scenario. Okay. I'll give you an example. So I have been training as aggressively as I possibly can since I was 12 years old. Mm-hmm. And my mother has never lifted a weight in her life. So she has, completely fused lumbar spine, and my lumbar spine is fine. Couple asymptomatic bulges. We both have a herniated C6, and both have an osteophyte complex in the same way. So you see some of these genetic patterns, mm-hmm. but also you see the same kind of wear and tear often in somebody who trains and who doesn't train. So I've often, in my own self-serving platitudes, would say, I would rather, have some injuries from being active than have the same degeneration or injuries from being inactive. So you're really risking the same type from inactivity versus activity. But I'm not a sports medicine specialist like you. I have not seen the kind of patient load you have. So where do you come down on something like that?
Well, to the spine, if you can go back to the spine, the age thing does matter. As we get older, the discs are made out of a gelatin. Pardon my dogs. I'm sorry. Age is made of like a very thin or thick gelatin-like rubbery material, and it's surrounded by a ligament that is like a steel belted radial on a tire. But that belt around the disc over the years, just from even without doing anything, can start to age and start to weaken. And it weakens right in the same area where the nerve roots exit the spine to go to the extremities. How fortunate that is, right? So in the absence of having any pain or any traumatic injury, if I took 100 people in the middle years of life and just ran scans on their spines, they had no pain troubles at all, I'd probably find almost all of them would have some bulging disc. It's kind of an overcalled diagnosis. If there's pain to go with it, it's probably not the disc, and it's probably the structural support, the muscular system that's giving the trouble, and not the disc itself. And I don't think that the concept of a bulging disc is actually a familial, hereditary thing. I think it's just a process of getting older. When the ligament tears and there's a disc herniation, that there may be an increased susceptibility from one person to the next based on the family thing. But it's not purely a hereditary problem. And I would never counsel somebody who has a bulging disc to shut it down unless there was a pain problem. And then I would have to drill into where the pain is coming from.
Mm-hmm. So if you toggle between those two extremes, you've got people who are very sedentary, people who are willing to risk anything at all to get that next big lift. Is there a way, in your opinion, to be that aggressive and still be somewhat safe? I mean, I know we're dealing with soft tissue and even, as you said, compression and stress fractures, but have you seen people who can make it through an entire career without ending in just a pile of osteoarthritis?
Well, that's it's still a fairly broad question to answer. In concept, it's probably looking at guys like Luke who train people appropriately and push their limits, but staying outside of the aggressive risk of the 1 rep max. I mean, shooting for that at some point once in a while, I guess, is okay, but using it as a constant moving target frequently is probably not wise. Using your smaller sets or your higher repetition sets to stack into your lower repetition sets is going to be smarter, but that's forgetting even the need for the 360-degree body. You can't think of yourself as a set of quads or a set of biceps or pectoralis. You have to think of your shoulders. You have to think of the muscles on the back of your shoulders, the scapular muscles that support the shoulder blades. You have to think of the core to support your spine, and you have to think of the core actually even to use your legs. So and your backside, your gluteal muscles. So you have to train in balance and allow for appropriate recovery from a hard workout. When you're doing high risk lifting, you can't hammer that, or you shouldn't. I shouldn't say can't. Best advice would be you shouldn't hammer it several times a week to get it to build. You have to let the muscle that you're injuring to build. Because essentially at the beginning of a workout routine, you're telling the very first time you step into the gym to do whatever exercise it is, you can do only so much. And that's what your brain is telling the number of fibers in your muscles to do. And you only have a certain number of them that are working. Eventually your body gets smarter, brain to body connection gets smarter. And in the first couple of weeks, you might notice an increase in your strength without seeing any physical changes. That's because you've restarted to recruit more of the fibers in the muscle to do the work. And then you tap out as a plateau. That's because you don't have any more fibers to work with. And after you plateau, then you start adding more muscle fibers, and then you can start to see increases again. But during that whole time, you need to allow for the regeneration of the muscle. Every time you do a pretty significant stressful exercise, you're creating some level of microscopic damage to the muscle that it needs for adaptation. And if you don't let that happen, you're going to start tearing down. That's where stress fractures come in bones. And the tendinitis and the ruptures of the muscle are the stress fractures of the muscle.
Yeah. And I have seen in the last 10 to 15 years a huge surge of interest in looking at the correct frequency, duration, and intensity. And people like Mike Zordos with this, rep scheme. They're charting it with reps in reserve, and so they're trying to create a scale that if 10 is max, you could, that's as many reps as you could do. Let's do a 10 minus 2 or do an 8. So that's kind of 80%. And they're trying to calculate this so that people understand the concept of intensity. And especially because, there are guys like me who just have thought for 35 years, just train as hard as you possibly can, but then give yourself enough time to recover. So I've always been very, very big on recovery, but I would measure that in how many days it takes to recover from something that was, just max effort. And now the big trend is to train multiple times, the same muscle groups, maybe, different lifts, different stimuli, but hitting that same muscle group at least twice, sometimes 3 times a week. Have you seen increases or changes in muscular injury based on some of these increasing frequencies?
No, I won't. I will say I've seen an increasing number of middle-aged guys for working out with a certain company that I won't name that tends to promote the gorilla in the gym attitude. And I still go back to that what I said earlier about, the regaining the lost youth idea that, nobody wants to feel like they're getting older. That's probably where I see more of it. I don't see it so much in the younger guys. And you're probably a lot closer to the physiology science of those things that you're quoting with the periodicity and intensity than I am. But the guys who are me or you in our age group, we tend to be the ones that still think that old school works. And we don't think about flexibility training. We don't think about aerobic training to be cross-productive and giving the body an opportunity to recover from one thing while we're building on another. Mm-hmm. And we're more susceptible to trouble than the 20-year-old.
Yeah, and if we go back to even the beginning of our careers, and maybe for the sake of argument, one of the first trends came about, talking about core strength, and then things transitioned into looking at even balance and flexibility, but then functional training and CrossFit. And I have to say, one of the biggest advents I think has been functional training, where you're doing a lot of athletic movements, very 3-dimensional, not just linear lifting. The problem is it's very difficult to fit everything in. So you've got people who still want all of the mass benefits of hardcore strength and muscle building type training. But then, when can I fit in some stretching or some yoga, and when can I do some functional work? And, it does become a problem with not only time, but recovery. And I was just curious if even on the professional level, you saw athletes struggling to get it all in, or are they pretty much just doing what their team trainers say?
Well, on the athlete side, at the professional level, they're doing what basically the strength and conditioning coaches are the ones that rule their workouts. They don't really veer too far off the pathway. Maybe they do when they're on their off season, but typically even during off season time, the strength and conditioning guys are the ones who are giving them the off season workouts to work on, and they're expected to follow them. They're under contract, so they're getting paid to do that. Even the kids who are on scholarship at major division universities are still on a contract, so to speak, because their scholarship is being paid for, and they have to follow suit. And if they don't, they lose their position. So I see honestly a lot more Joe average person than I do of it's the bell curve. A very small percentage of people in this planet are elite level competitors in whatever activity they're in. And the majority of us sit in the middle of that curve, and we're the ones who think that we're like the guys who are at the top end of the curve, and we're the ones that are at the biggest risk for a problem.
Mm-hmm. Well, let's talk about that person who might be just starting out, and in our company with coaches and program owners all over the planet, we do have clients coming in who have been sedentary their entire lives. They might be in the process of losing a significant amount of weight. And so what would your advice be, having seen everybody from that first step to elite athletes, for their physical health? What's the trajectory or advice you would give them?
Start first with a good health assessment. Make sure that there aren't any underlying conditions that may predispose to problems. Like a 35-year-old or older adult who's out of shape may be a risk for heart disease, and we don't really know it because it's a silent problem. So I want to know that that's not an issue stepping into the gym. For someone who has a very clean medical history, but is definitely needing some help or wanting to start entry-level working out, it's not a bad idea to get involved with this a very experienced trainer to work with, to make sure that form is proper, that the amount of working out is appropriate, and giving them some reasonable expectations. Don't be looking for setting records as much as like elite records, but set your own personal bests. Start out with what you're able to do and use it as your benchmark going forward. And don't try to feel like you have to build this Rome in a day.
Mm. Yeah, it's sometimes very difficult to put myself back in the position of somebody just getting started.
Right.
But I've had the opportunity to train in a lot of gyms this year, everywhere from the West Coast here to Italy to Australia, and I'm always observing, and when I'm in a big gym, because usually I'm training in my own private facility where I can be by myself. And
Sure.
when I see young personal trainers working with clients that are obviously new to the gym, it's almost heartwarming, for lack of a better word, for me, because I can see that excitement and trust on their face, and the fitness professional is excited to be sharing this information. And I think, wow, it's great that they're here working with somebody who knows something about biomechanics and programming. And I see that all the way up to somebody like Luke Probst, our training director, doing extremely high level, training protocols for professional bodybuilders and powerlifters in our company as well. And, that's really great to see how much our industry has grown just in the last 20 to 25 years.
Well, I'm seeing a lot, actually, even in my older adults, push past 50, who are going to the gym and have trainers, and they're excited about going to the gym and working out. And the trainer beat me up yesterday, and they're happy to tell me that. They're actually excited about being sore the next day. That's really a nice picture too.
Well, my 75-year-old mother-in-law, I just found out today, is scheduled for a knee replacement. So I'm at least just happy that it wasn't me first, because I know my time will be coming at some point.
Coming.
Yeah, sooner than later, I'm afraid. But Dr. Braunreiter, I want to thank you, and for all of our listeners and viewers, I want you guys to know that if you have any questions, you can always contact us. Dr. Braunreiter is an adjunct medical director for us. He and his wife own the Diet Doc of Sugar Land, Texas. And David has been so generous with his time with a lot of our program owners. Every time somebody has a question, a medical question, especially in our private owner forum, Dr. Braunreiter is just one of the first people to jump in and always be very helpful with that. So I can't thank you enough for that, David, very, very much.
Oh, you're welcome. I appreciate the respect and the camaraderie that the company has.
Awesome. So you guys have any questions that you want me to float by David? We might have kind of an open Q&A when we post these links. But David, thank you so much. And I want to thank you guys for watching and listening. And we will catch you next time.
Take care, guys.